This learning resource has been developed by Helen Lambert, Covio Dementia Training, in collaboration with Social Care Wales and Health Education and Improvement Wales. In it, we share some simple advice to support people living with dementia. None of this is new information. It's bringing together some widely agreed principles that might help whilst recognising that everyone is different. No two people with dementia will experience it in the same way. To group people together as the same by virtue of a diagnosis is wrong. To use negative language, such as dementia sufferer, senile, and not all there, is discriminatory and unacceptable. Everyone is different, with different skills, wants, and needs. However, there are some things that we can do that are generally considered good practice in supporting people living with dementia. So this resource is not prescriptive, more informative. The emphasis is firmly on the difference your interactions make in the care and support of people with dementia. Be friendly and show the person you care through your facial expressions, body posture, and tone of voice. If you are in PPE and some of your facial expressions are masked, how you say things will become even more important. People will hear your friendliness in your tone of voice and see a smile in your eyes. Get into the habit of introducing yourself every time you approach the person. Think about your position. We don't want to tower over people or invade their personal space. People will experience a whole host of different symptoms depending on the type of dementia, how their dementia is progressing, and their personality. Most people will know about memory impairment, but another symptom that has a significant impact on the person with dementia and is often overlooked is a change in vision. Because of the change in visual field, what the person can see is limited. They lose their peripheral vision. When thinking about your positioning, approach from the front, in line of vision, and once the person knows that you are there, move to the side. Use the person's preferred name to get and maintain their attention. Mr. Knight, James, Jim, Sir. Avoid the use of terms of endearment unless you know the person responds well to them. And never treat people with dementia like children by using terms such as good girl, good boy. Most of us will have been taught to explain everything that we are doing when we are supporting people, and for many people that helps. However, as dementia progresses, communication will change, even in the early stages. People might struggle to understand the spoken word and will rely more on your non-verbal communication. Important messages can get lost amongst the chatter, so less talk and use your words wisely. Exaggerate your non-verbal communication to support your words. Your gestures are going to be even more important if your face is hidden by a mask. Give people real choices by showing the actual object rather than only saying the word. If we can't show the object, can we show a picture at least? Before you start to do anything, explain in simple terms. Double-check that the person has understood what you're planning to do and get their consent first. Avoid too many questions that need a correct answer. Instead, try asking a person to tell me about. This opens the conversation and allows the person to tell you what they can. Listen very carefully to what the person is telling you with their words, but also pay attention to their non-verbal communication and how they are saying it. Even when the spoken word is muddled, you may get a sense of what the person is trying to say through picking up on a few keywords. Sometimes people will talk around a word they are missing and describe it. You wear it on your wrist and it tells the time. If you know what it is, you can tell them the word. You want your watch. Sometimes a person may not be able to express themselves fluently, but can make their feelings known by swearing. Try not to be shocked or offended. It's not personal. You may want to acknowledge the emotion. You are angry, you are scared. We should not be telling people off for swearing. Do your best to manage your own reaction. Thank you for your time in watching this video and for everything you are doing. I hope that this has helped in some small way.